Today, we're going to talk about a condition that affects millions of people, often without a single symptom. It's hypertension, high blood pressure. They call it the silent killer, which sounds scary, right? But here's the thing, it is absolutely manageable. So, let's get into it.
So let me just start with a question. What if I told you there was a major disease out there, and half the people who had it, well, they had no idea? That's not a hypothetical. That's the reality with hypertension, and it's exactly why we need to be talking about this.
So, here's our game plan. We'll kick things off with that hidden epidemic. Then, we're going to decode what your blood pressure numbers actually mean. We'll dive into the risk factors and then get to the good stuff, your prevention playbook, including a deep dive on the DASH diet. And finally, we'll wrap up with how you can really take control of your health. To really get a handle on just how massive this problem is, there is this concept that health experts use, and it spells it out perfectly. It's called the Rule of Halves. And honestly, when you see it broken down, it's pretty shocking.
Okay, so let's just imagine the entire population. According to this rule, about half of us have totally normal blood pressure. Great, but that leaves the other half, 50%, with hypertension. Now, this is where it starts to get really crazy. Let's take just that group of people with hypertension. Of that group, a staggering 50% of them don't even know it. They're walking around completely undiagnosed. But wait, it doesn't stop there. Let's narrow it down again. Of the people who do know they have high blood pressure, the ones who've been diagnosed, only about half of them are actually getting any kind of treatment for it. And for the final, crucial step, even among the folks who are getting treated, only half of them have their condition properly under control. Do you see the pattern here? At every single stage, we just lose half the people. It's this massive cascade effect that shows you just how many people are living with this dangerous condition totally unchecked. So after hearing all that, you're probably wondering, what even is high blood pressure? What are those numbers they give you at the doctor's office? Well, to really get a grip on the condition, you gotta understand the numbers first. So, in the simplest terms, hypertension just means the force of your blood pushing on your artery walls is consistently too high. And it's always measured with two numbers. The top number, that's your systolic pressure. Think of it as the pressure when your heart is actively beating. And the bottom number is your diastolic. That's the pressure when your heart is resting in between beats. This chart here really breaks it all down. That sweet spot, what we call optimal, is anything less than 120/80. As those numbers start to climb, you move into different stages of hypertension. And, this is really important, if you ever see a reading over 180 on top or over 110 on the bottom, that's what's known as a hypertensive crisis. You need to get medical help right away. So the big question is, why? Why do some people end up with high blood pressure and others don't? Well, it really boils down to this mix of things we have absolutely no power over, and then a bunch of lifestyle choices that are very much in our hands. And, knowing the difference between the two is everything. So let's think of it this way. We can split these risks into two big buckets. On one side, you have the things you just can't change. The hand you were dealt. And on the other side, you've got the stuff you can control. And this is where you can make a huge, huge difference. This is where the power is. First up, the stuff you can't do anything about. Your risk just naturally goes up as you get older. Your sex also plays a part, with risks changing for men and women at different stages of life. And yet, genetics, they're a big one. If both of your parents had high blood pressure, your own risk shoots up to about 45%. Ethnicity can also be a factor. Okay, now for the part that really matters. The factors that are in your court. This list is pretty much all about lifestyle. Things like obesity, eating too much salt, a diet high in saturated fats or low in fiber, alcohol, not being active, and stress. All of these are major players. And this is our shot to fight back against that rule of halves we talked about, by making choices that keep us out of that cascade to begin with. All right, so now that we know what we can control, let's look at the incredible impact that just a few positive changes can have. Seriously, think of this as your playbook. And the numbers we're about to see, they are super motivating. Okay, get this. Just managing your weight is one of the most powerful things you can possibly do. Losing just 10 kilograms, that's about 22 pounds for us, can drop that top number, your systolic pressure, by as much as 20 points. I mean, that one change alone can take someone from a high-risk category down to a much, much healthier one.
And salt is another huge one. Just cutting your daily intake to less than 5 grams, which is roughly a single teaspoon, can lower your systolic pressure by up to 8 points. It's such a small change in your day, but it has a really big payoff.
You can't deny the power of just getting up and moving. Regular aerobic exercise, and we're not talking about running a marathon here, just a brisk walk, a swim, or a bike ride for about 30 minutes most days, that can lower your reading by up to 9 points. And yep, moderating your alcohol intake makes a real difference too. Cutting back can lead to about a 4-point drop in that top number. See? Every single one of these actions starts to add up and chip away at the risk. So, we've talked a lot about diet being a critical piece of the puzzle. You might be thinking, okay, is there a specific plan I should follow? And the answer is a big, resounding yes. Let's talk about the DASH diet. It's one of the most proven, well-researched eating plans out there for managing blood pressure. So, DASH actually stands for Dietary Approaches to Stop Hypertension. The first thing you need to know is that this isn't some quick-fix weight loss diet. Though, hey, losing weight is often a happy side effect, it's really meant to be a sustainable, lifelong approach to eating that is specifically designed to get blood pressure under control. And the philosophy behind it is refreshingly simple. It's all about focusing on what you can add to your plate, eating more of the good stuff. So the diet is absolutely packed with fruits, vegetables, and whole grains. It also encourages you to eat low-fat dairy, nuts, beans, and lean proteins like fish and chicken. And then, on the flip side, you just consciously limit the things that tend to raise blood pressure. So that means cutting way back on saturated fats. Things like butter, cream, and fatty red meat. It means steering clear of sugary drinks and sweets. And, no surprise here, it means keeping those high-sodium processed foods to an absolute minimum. All right, we have covered so much ground here. We've talked about the hidden problem, what those numbers on the cuff actually mean, and the powerful tools we have to fix it. So now, let's just bring it all home and put it together into a clear, simple plan for taking control for good. Think of this as your personal checklist to beat that rule of halves. Number 1, monitor your BP. You can't manage what you don't measure, right? Number 2, follow your plan. Consistency is everything when it comes to diet and lifestyle. Number 3, stay active. Make it a non-negotiable part of your day. And finally, number 4, talk to your doctor. You're not in this alone, they're your partner in health. In the end, your blood pressure is so much more than just a couple of numbers on a screen. It tells a story. It's the story of your health. But here's the best part. You are the author of that story. So the only question left is, are you ready to write a healthier next chapter?